Hello everyone, I'm Ariel Benis and I will present you today with Stéphane Darmoni our work to automate the elicitation of human and ecological health indicators as a practical implementation of OneDigital and by using LLMs. So by looking at One Health and digital health, we developed a few years ago the OneDigital framework. You have on the left side of this slide the reference to the seminal paper. And we aim with OneDigital to look at these two keys, the One Health and digital health, from three different perspectives by looking at the individual, the population, and the ecosystem from 5 dimensions: the education, from kindergarten to continuous education, to the environment, healthcare, the human and the veterinary one, the industry by looking at standards and interoperability, and to the citizen engagement. All these perspectives and dimensions being related, interconnected by using technologies. One very important aspect of OneDigital is that we are integrating the FAIR principles in order to be able to find, access, interoperate, and reuse our data and systems over time. So ODH has been adopted by the OneAquaHealth project, a European-founded project running for 4 years between 2022 to 2026, involving 13 institutions from 9 countries, and aiming to improve the sustainability and the integrity of freshwater ecosystems in urban environments. In other words, and to simplify, of rivers in cities, considering that the interaction of these freshwater streams with humans and humans with these freshwater streams are critical for the health of both of them. And we aim to identify early warning indicators to enhance the environmental monitoring, and so to improve the quality and the health of these ecosystems and of the humans. As a part of this project, we have to process to a number of literature reviews in order to identify indicators in the literature that can be relevant for the project, and to initiate the definition of others. It's very important to understand that over time the scientific publications are growing, and it's impossible for a human team to be really exhaustive in a literature review. Thus, the LLMs, the large language models, can provide an alternative or a complement to be more efficient to process the literature faster and in a scalable way. On the second hand, we have methodologies like the PRISMA one, the preferred reporting items for systematic reviews and meta-analysis, allowing us to define the different steps to process to a literature review. So when we are looking at integrating the LLMs to this PRISMA approach, we can look at the OneAquaHealth reviews from a new perspective. So our main aim with this project was to rapidly identify the human and ecological health indicators in urban freshwater ecosystems in the literature by considering the FAIR principles and so the fairness. Our goal was to develop an LLM-powered platform allowing to analyze the literature from the OneAquaHealth and OneDigitalHealth viewpoints. And our objectives were to automate this systematic literature review by using the LLMs. So by developing a comprehensive automated literature review, focusing on our project, and to identify health indicators in order to support the development of new ones. So our methodology was built around two main parts. The first one focusing on collecting the papers, pre-processing and screening, and the second one dealing with the data extraction and providing to the expert synthesis of all the papers. Our methodology starts with the first part comprising collecting papers from PubMed by using dedicated search queries, by collecting for each paper the metadata related to this paper and the related abstract. Then we are screening all the papers to categorize them according to their link to human health, animal health, ecological health, and if they are related to blue spaces. I mean here the freshwater streams that OneAquaHealth is focusing on, and we are going forward by applying our inclusion-exclusion criteria, looking at the language of each paper. We are excluding all the papers that are not in English, that are not in our time range of 2013 to 2024, and so on. So by considering each paper, we are going forward with the eligibility, and we are looking at potential indicators related to OneAquaHealth in each paper, looking at the methodology and the population involved when we are looking at humans, when we are looking at animals, or at different green spaces. We are also considering and searching for links to OneDigitalHealth by considering the keys, the One Health and Digital Health, the perspectives, the individual population and the ecosystem, and the dimensions that we described before. After this screening process, we are getting a summary for each paper comprising the PMID, the title of the paper, one digital health score, pointing out if the paper is related to OneDigitalHealth. Here, for example, we have one which is less related to OneDigitalHealth, pointing simply out does not directly address the broader digital health ecosystem, but we are getting also a summary regarding the OneAquaHealth score, pointing out that this paper, for example, addresses the challenges of urbanization on fresh water ecosystems, and focusing also on citizen reporting to enhance early warning indicators and monitoring. So this paper is with an high score for OneAquaHealth and a lower for OneDigitalHealth. So we can go forward, for example, for our review. At the end of this process, we are getting a full assessment comprising different sections, the paper aims, the potentially interesting OneAquaHealth indicators in the context comprising the geolocation of the research and the methodology, the key findings related to OneAquaHealth, and the OneDigitalHealth key perspectives and dimensions involved. At the end of all this process, we are able to complete the PRISMA flow diagram. We started with more than 10,000 papers. Considering the limited resources, computational resources that we had here, we just investigated, analyzed 1,000 paper, and we focused at the end on the analysis of 32 papers. A very large part of them overlap with the papers that our human expert team in OneAquaHealth discovered by a manual or semi-manual analysis. The very last step of the automation process is generating insights from the corpus, meaning the 32 last papers. We are asking the LLM to act as a biomed scientist with an expertise in human health, well-being, and involved in OneAquaHealth, and in order to categorize, cluster the papers according to the patterns and the different terms, topics of the papers, identifying indicators that could be relevant for environmental monitoring or for disease detection, and so on. And this last step allows us to get an output, for example, like this one, with a subset of papers that are similar in content and indicators, with a summary regarding the pattern, the correlation, the terms and topics involved, with the indicators appearing in these papers that can be related to OneAquaHealth, and potential hypotheses or hypotheses to go forward with this set of paper. To conclude, it's very important to consider that the full pipeline, the entire pipeline from collecting the papers to the last outputs that I presented just a few seconds ago, it completed in under 24 hours, when we are comparing a standard PRISMA process taking a few days, few weeks, if not few months. We need to integrate different LLMs to benefit of the different advantages of each one. It's really important to consider that this time reduction by using LLMs allow us to get concise, accurate, and well-phrased reports, but all depends on the prompt engineering when we want to get a structured answer with yes, no, true, false, or free-form response by asking the LLM to be creative, and all is related to the temperature settings of our run. So we have some limitations. We used a combination of closed and open source models. The closed systems or the cloud-based systems can have a limited transparency and adaptability. It can be expensive. The flexibility provided by the open source one can be also challenging, because we have also limited local resources and can be also with lower performance. We need to involve the human, but also we need to consider that there can be some oversights. And the most important, because LLMs are power consuming, human time consuming for the development and adaptation, we need to consider that we can have potential biases like hallucinations. We may have some data integrity challenges to handle. And the most important, and I pointed it out a few seconds ago, LLMs are power consuming, can have important footprint, and we need to go to a green informatics. So we need to use with some right limitations or in the right context these LLMs for getting the right support to research and to clinical practice. Thank you for your attention. If you have questions, you can reach me by email at one of these two addresses, or to ask Professor Stéphane Darmonier, which is in the audience today. Thank you.